My name is Jason, as I indicated before. I live in Lehigh County in the Macungie area. I run Cedarbrook Senior Care and Rehab, which is the third largest nursing home license in the state of Pennsylvania. It's owned and operated by Lehigh County. At this point, in 2020, we're one of 17 counties left in the state that still owns a nursing home. It was more prevalent in the past, but over the years, a number of homes have been privatized. Cedarbrook takes care of a large dementia population, and the mission of a county home is to take care of the most unfortunate in society. Everybody deserves great care. We provide that care to people that can't necessarily receive it at other nursing homes. That's kind of who we are. We, at any one point in time prior to the pandemic, we would take care of about 630 or so residents between the two campuses. The one campus is here near Dorney Park in South Whitehall Township, and the other campus is in Fountain Hill. And again, it's a largely cognitively impaired type of population who we take care of. In a normal basis, it's about 630 residents, as I indicated, and a little over 900 employees between the two campuses here. Would we reacted any differently? I don't know. It's a good question. The resources were very limited back in March when the pandemic hit Pennsylvania initially. Those resources being just knowledge of the pandemic in general. That has changed a great deal over time. That's gone from more of a concern with contact-based infectious disease spread to now it's moving more toward droplet and airborne rather than contact-based. So we did what we knew to do back then. We truly improved our surface-based decontamination routines and such in preparation. It hit very early in the pandemic in Eastern PA and New York and New Jersey. So we're kind of writing the science now for the rest of the country as far as this is where the data is coming from, this part of the country. But yeah, it's tough to say, would we have done anything differently? It's been some experience, I'll say that. We are temping everybody that walks into the facility, screening them for signs and symptoms of COVID. And we have masked up the entire building. And initially, here's one big change that occurred through the pandemic. In the same vein as what I was talking about before in terms of contact versus airborne-based transmission, initially, the guidance was not to mask up at all unless you were taking care of a COVID resident. That has changed quite dramatically. And at this point, all of our staff members are wearing N95s on our nursing floors, regardless if they're a COVID floor or not. So that's been a tremendous change, actually, in terms of how we're handling things. But yeah, the testing, we're testing at this point weekly. We might be going back to a more monthly based testing soon, but we're performing over 1,200 COVID tests per week at the two Cedarbrooks between residents and staff, and that's really dominating everything that we do right now. Everything that we do now is COVID based and not so much based on other normal concerns of a skilled nursing facility. And it's more about safety and security rather than the fun that exists in nursing homes, with outings and big forms of entertainment in our large auditorium and such. So that's changed a lot for the residents. Truly, it's been tremendously difficult on them, more so than anybody. Because at the end of the day, I can go home and I have that outlet with my family and such. For the most part, our residents are stuck in their rooms and on their units right now because of the pandemic. So life is very difficult for them. Tremendously difficult. Everything was in short supply. It was astonishing to us, actually, that the country itself was not better prepared for the pandemic. Looking back, I wish that the country would have ramped up manufacturing of PPE back in January, when we started getting an inkling of what may or may not be coming to the United States. That has been astonishingly bad. There's been a number of nursing homes. Thank God it wasn't us, although it got darn close. But there's been a number of nursing homes that the staff were wearing garbage bags in lieu of gowns, which that morphed into being the most difficult piece of PPE, and not the masks, the gowns, even to this day. Even the hospitals have been having a lot of trouble with the gowns and the masks. And we've been using the same form of CDC crisis-based supply strategies as the hospitals for preservation of N95 masks and such. We are looking now, and it's too early to talk about this in terms of formal plans, except for one component of it. We're looking at building design and such, and we were designing a renovation anyway, with or without the pandemic occurring. And we're looking at ways to improve HVAC and things like that, to perhaps have a mitigating effect on this in the future. Specifically in light of what the CDC had put out recently, a few weeks ago, I believe, in terms of the coronavirus potentially being airborne as well as just droplet based. And their current guidance indicates that in some settings where there's poor air circulation or air ventilation, that it could linger in the air for an extended period of time. And using that type of knowledge, we're looking at the design of these buildings. Cedarbrook itself is very old. It's been around for over 175 years, and our two oldest wings at Cedarbrook are 1920s in terms of their design and construction, and the newest wing is 1970. Fountain Hill it's 1972, so it's older technology in terms of building design. So there's a lot of neat things that have come about recently. Technologies that we may or may not be able to incorporate, like ionization, things like that. Maybe in the future, when somebody's looking at this video, they'll think, wow, well, we did that, 20 years ago. But we're just looking at that kind of thing now. We use FaceTime to be able to connect the residents with their families. We were able to open up visitation for a short period of time until we had to shut it back down again, because the current regulation that exists right now indicates that if you have one documented case, regardless of the size of the nursing facility, you have to shut it all down. So that's what we had to do a few weeks ago. But primarily it's been electronic in terms of connecting them through FaceTime or Skype in some situations. We have done our best to keep the family members updated via our website. We have statistics posted there, which isn't really the most proper way of doing it. So once a week, our social workers call all of the families on their respective units to update them with what's going on at the facility. That's actually worked quite well. I've seen. Every morning I get my weekly update. So I actually have it right on the screen here. So we've had 246 residents positive in Allentown since the start of the pandemic, and 45 at the Fountain Hill campus. And in terms of staff, 126 employees at Allentown and 42 at the Fountain Hill campus.
All right.
The fear of the unknown. That was the scariest thing for our employees.
Yeah.
This was the, excuse me. This was the first area of the country to we go through the pandemic. Being the first area of the country, it was certainly the fear of the unknown. Certainly. Yeah. What we have done is that we have made our chaplain services available for all of our staff members for them to help cope. We've also reached out to a behavioral health service with the local hospital system. For the residents, we've used the chaplain service. We've used our psychology services as well. Not that I can think of, just that it was an interesting experience thus far in terms of being the first to go in the United States between New York, New Jersey, and Pennsylvania. It was very scary for the staff, and what really helped calm people down was just keeping them updated. We were totally transparent with everybody. Every Monday, soon I'll be conducting my weekly email to the entire site to let the staff know what's gone on since last week in terms of any new cases. And actually, fingers crossed, we've had no cases here in Allentown over the last week, despite producing a lot of tests. And Fountain Hill campus, we only had one case over the last week. So it's been, being open and transparent with them, because the natural assumption, particularly at the beginning with everybody, is that you're trying to mislead people or hide things. So when we went to very early on these regular, at the very least, weekly emails, and that's Trent that at times has been 2 or 3 times a week, to just keep them updated and engaged. And the same thing that I was indicating with the family members as well, that really calmed things down. And you have to make time to do it, no matter how busy you think you are. And the days have been very long for a number of our staff, whether they're staff working on the floors, the nursing floors. A lot of them work many days in a row just to help fill spots, particularly when we had people go down with COVID infections themselves. And it was, a lot of hours for the management staff as well. A number of them work weeks and, every day, for weeks in a row. And it was a lot of, there's a lot of stress involved, but, getting everybody engaged and allowing people to express anger about the situation or whatever the case is. The worst day of the pandemic, believe it or not, was our very first case of COVID. And because we're a county nursing home, we tend to media release a lot. So this was big news. It was, I believe it was March 17th of this year. And whenever anything negative happens in the skilled nursing facility, it's inevitably on Friday, after 3 or 4 o'clock. And that's when this happened. It was actually a younger staff member, interestingly enough, only probably about 30, 35 years old, that was the first COVID case. whose significant other actually worked in a hospital, and I think that was the path for that person's infection into the household. But that night, that I will never forget that night the rest of my life, because it hit the news, and we were here till almost midnight helping to contact trace where this person was in the person's department, and calling that person, getting the department to help